my name is Erin Ziegler. I use she, her pronouns, and I am a nurse practitioner, and I am the lead of the gender program here at Queen Square Family Health Team.
Yeah, so I'm Simona. I'm one of the pharmacists on the team, and my pronouns are she, her.
So the gender clinic program here is a primary care program that provides gender-affirming care to anyone that identifies as trans, gender diverse, or gender non-conforming, non-binary. And what gender-affirming care is any sort of care that relates to their transition. So whether that be social, medical, surgical, or legal transition, then we provide that support from a primary care perspective.
It's a nurse practitioner led program, which is a collaborative model of care where there is support from social work, there's support from nursing, and there's support from pharmacy to guide patients through their needs with regards to gender-affirming care.
This program has been at Queen Square. It'll be 5 years this May, but I've been doing gender-affirming care programs for over 10 years in the Peel region. And I think, one of the things that I would like is for more capacity to be built in the community. So not only for the program to be providing care to the patients that need it, but also for there to be the opportunity for learners, whether they be student learners or they be other healthcare providers, to come and be at the clinic so that they are able to take that knowledge back to their own practice.
I would appreciate, all healthcare providers getting at the very least the basic training that we typically receive in this clinic setting. Like there's some programs provided through Rainbow Health that are able to communicate with patients who are seeking gender-affirming care.
It doesn't need to just be this clinic. It needs to grow and develop, not just within this region, but across.
And in a way that doesn't cause relationship breakdown or any sort of friction.
And then also within this program, we need more funding because there are a lot of patients that want to come here. And so, we do need also more people to be working in this program. So I think one of the biggest changes that needs to be seen and made is that gender-affirming care really needs to be seen as part of routine, regular primary care. So yes, this clinic is a specialty clinic, but it is in a family health team, so it is part of a primary care clinic. Right now, there is still this notion that it is specialty care. And so I think there are still a lot of primary care providers who feel that they can't or they shouldn't be providing gender-affirming care because it should be done by a specialist. That really needs to be broken down, and that myth needs to be gone. It is not specialty care. It is primary care. It should be done in primary care practices. It actually should be done by the primary care provider of that person to maintain continuity of care. And so that's one of the biggest things that needs to happen, is that if an individual who identifies as trans asks for hormone therapy, they should be able to get it from their family practitioner, instead of their family practitioner saying, no, I don't do hormone therapy, or no, I don't do gender-affirming care. They should say, yep, no problem. Or they should say, you know what, I've never done this before, but I'm going to figure it out, and go from there. And so I think that's right now the biggest gap, is that there's still these barriers put up where patients are asking for gender-affirming care from their primary care practitioner, and they're not getting it. And so I think we need to move away from this notion that this is specialty care, have it embedded into routine primary care, because that is what's going to improve access and eliminate a lot of these barriers. And yes, there can still be specialty clinics that serve this population, but I think there's so many patients that are still underserved or don't have any access at all, that have really fantastic relationships with their primary care provider, that by just eliminating this myth and getting gender-affirming care as part of primary care, the same as diabetic care is, and the same as, if you have high blood pressure, you go to your primary care provider. This is what needs to be done.
Just making sure that it's as accessible as possible.
Just because my program's here doesn't mean that there's not wait times, there's not enough programs providing this care, but then there's still the whole access issue for the trans and gender diverse population in terms of them being able, from a systems perspective, accessing gender affirming care. I think the government recognizes portions of gender affirming care. They pay for gender affirming surgeries, but there are still barriers in terms of accessing care. And so I think we really need to, again, raise awareness. We need to raise awareness that this is life-saving care. It's not optional care. It is mandatory. It's required. But it is heartbreaking to still know that patients are driving a really long time to come and see me, or that even we have to have a wait list because there's not enough providers, and I still have capacity issues, and we still then have a wait list. And so then, even though we try to keep our wait list not very long, or we've even had to close our wait list at times because we don't have enough spaces to see all of the patients, then it's heartbreaking, and it's really hard when we can't see the patients, or then to hear their stories about how their personal well-being or their mental health or their overall general health has declined because they didn't have access to care.